this chapter named Immune Deficiency. It is the part of immunology. Here we talk about the autoimmune disease and defect. So first description, immunodeficiency is the absence of inadequate production of immune bodies. So the body does not produce enough immune cell. The disorder can congenital or acquired. So if the baby born with defect, we call congenital. If baby has a genetic disorder after the birth, we can call secondary or acquired. The treatment depends on inadequate immune bodies and the primary care. So when you go for the give the treatment to your patient is depends on inadequate immune bodies. We could find out the what particular cell is defective and also any underlying primary cause we could find out. So if our patient has a autoimmune deficiency, usually they present with or the factor that decrease the immune function or frequent infection, nutritional status, medication history such as use of corticosteroid or history of alcohol or drug abuse. So the person who used the steroid for a long time, they have a chance to develop immune system collapse. Or if anybody has a prolonged nutritional deficiency, the immune system will be depressed. So if you want to boost up your immune system, you need a good quality and enough quantity of food, right? Also, frequent infection easily catch them if you are immunosuppressed. Then here the intervention. What is our intervention? Protect the client from infection or promote the balanced diet with adequate nutrition. Use the strict aseptic technique for all procedure. So if your patient are diagnosed the immunodeficiency condition for any causes, for any disease, what we could follows, what is our intervention? We promote them, we give them good food, balanced food that contain adequate nutrition, or we protect them from any kind of infection. So use strict aseptic technique for all procedure or process. Provide psychological care regarding lifestyle change and also role changes. Reinforce the instruction to the client in measure to prevent infection and to wear a medic alert bracelet. The priority concern for a client with immunodeficiency is infection. So, what are the most important priorities if my patient under diagnosis of immunodeficiency? Infection control. So save them to catch the infection. So the priority concern for the client with immunodeficiency is infection. What next? So now let me talk about the autoimmune diseases. So the body is unable to recognize its own cell as a part of itself. Autoimmune disease can affect the collagen tissue. So collagen tissue is a protein that make our artery, blood vessel, cardiac tissue. So one of the autoimmune disease is called systemic lupus erythematosus, shortly called SLE. Here we are going to talk about it. So SLE, a chronic progressive systemic inflammation or inflammatory disease that can cause the major organ or system to fail. So it is, some books say it is a multi-organ involvement disease. So in SLE, different system or different organ get involved, and finally organ failed and patient difficult to survive. Connective tissue and fibrin deposit collect in the blood vessel on collagen fiber and organ. So deposit lead to necrosis and inflammation in the blood vessel, or necrosis or inflammation in the lymph node or gastrointestinal tract and flora. No cure for the disease is known, but remission are frequently experienced by the client who manage their care well. So if anybody is diagnosed by SLE, it is difficult to be cured, or so many journals agree with you. They said no cure for the disease, but remission are frequently experienced by the client who manage their care well. So if at least if you stop the frequently remission or acute attack, at least life will be continue more. So survival rate will be extended. So in this flowchart and picture, we see different organ is get involved in autoimmune disease, especially SLE. Let me explain one by one. The first picture we can see thyroid gland. Thyroid gland here, it is getting bigger in size. In autoimmune disease, if attack the thyroid gland and bigger the thyroid gland alter the function, most commonly called Hashimoto thyroiditis or Graves' disease, hyperthyroidism. In second picture, we see the blood sometimes causes leukemia or lupus hemolytic disorder or dysglycemia. In GIT tract, patient develops celiac disease, Crohn's disease, or ulcerative colitis. It is autoimmune. In nervous system, peripheral neuropathy or diabetic neuropathy. In the lungs, asthma, Wagner granulomatosis, and the brain, multiple sclerosis, Guillain-Barré syndrome, systemic psychological Guillain-Barré syndrome and psychological problem, bones, rheumatoid arthritis, and ankylosing spondylitis, polymyalgia, muscle fibromyalgia, muscle dystrophy in the skin, eczema, psoriasis, scleroderma, or vitiligo. Next here, SLE can cause the cause of SLE is not known or unknown, but it is thought to the result from a defect in immunological mechanism and to have a genetic origin. Precipitating factors include medication, stress, genetic factors, sunlight, ultraviolet light, and pregnancy. Discord lupus erythematosus. What it is? Discord lupus erythematosus is possible with some medication, but totally disappear after medication is stopped. The only manifestation is skin rash that occur in lupus. In this picture, we can see the sign and symptom of SLE. Identify precipitating factor. So if we take the good history, you can find down some risk factor or precipitating factor that triggered the disease. Erythema of the face. So in this picture, you can see the malar rash, also called butterfly rash. This is the typical presentation of systemic lupus erythematosus. Sometimes patient present with dry skin, scaly, raise the rash on the face or upper body, or patient develop frequently fever, weakness, malaise, and fatigue. Anorexia, weight loss, photosensitivities means if they go under the sun, they feel abnormal sensation. Joint pain or erythema of the plum. Patient develop anemia, positive anti-nuclear antibody, shortly called ANA. So if you check the blood test, you can see ANA, positive anti-nuclear antibody test, or ANA test will be positive and lupus erythematosus preparation. So also elevated the sedimentation rate or ESR or C-reactive protein would be increased. In this picture, we are seeing in case of SLE, how different organ getting involved. Patient develop mouth ulcer or nose ulcer. In the lungs, pruritus, inflammation of the pleura, pneumonitis, pulmonary embolism, pulmonary hemorrhage. In the kidney, blood in the urine, hematuria, or hair loss, high fever, abnormal headache. So body temperature raise, hair loss, or headache is more common. If you check the skin, we found butterfly rash in the face. In heart, patient develop endocarditis, inflammation of the myocardium. Or patient develop atherosclerosis, inflammation of the fibrous sac, severe abdominal pain. Anemia, blood pressure. And also in the muscle or joint, pain and arthritis or swollen joint, more common. So what next? In case of SLE intervention, monitor the skin integrity and provide the frequent oral care. Instruct the client to clean the skin with a mild soap, avoiding the harsh or perfumed the substance. Assist with the use of ointment and cream for rash as prescribed. Identify the factor contributing to fatigue. Also, admin iron, folic acid, and vitamin supplement as prescribed if anemia occurs. Provide a high vitamin and high iron diet. Provide a high protein diet if there is no evidence of kidney disease. Otherwise, we can give them high protein. But high vitamin and high iron is important. Reinforce the instruction to measure the conserve the energy, such as placing activities and balancing rest and exercise. What are the next intervention? Admin the topical and systemic corticosteroid or salicylate and non-steroidal anti-inflammatory drugs as prescribed for pain and inflammation. Administer medication to decrease the inflammatory response. Monitor intake and output. Reinforce the instruction to the client to avoid exposure to the sunlight and also avoid the ultraviolet light. Monitor for proteinuria and red blood cell counts in urine and monitor for bruising, bleeding, and injuries. Assist with plasmapheresis as prescribed to remove autoantibodies and immune complex from blood before organ damage occur. So plasmapheresis is the option. So also we can monitor for the sign of organ involvement such as pleuritis, inflammation of the pleura, or nephritis. Inflammation occur in the kidney, or pericarditis means inflammation of the pericardium, coronary artery disease, hypertension, neuritis, anemia, and peritonitis. So note that the lupus nephritis occur early in the disease process. Provide supportive therapy as a major organ become affected. Provide emotional support, encouraging the client to verbalize their feelings. provide information and regarding support group, encouraging use of community resources. For the client with SLE, monitor the blood urea nitrogen and creatinine level frequently for sign of renal impairment. Now let me talk about the scleroderma or systemic sclerosis. So description: scleroderma is a chronic connective tissue disease similar to SLE that is characterized by inflammation, fibrosis, and sclerosis. So inflammation occurs in blood vessel or in the body tissue, fibrosis in lungs, or sclerosis in any organ. This disorder affects the connective tissue throughout the body. So everything is a connective tissue in the body, like artery, vein, then heart, blood vessel, even the basement of any tissue, supporting tissue, all connective tissue, RBC, red blood, platelet, everything connective tissue. It causes the fibrotic change involving the skin or synovial membrane, esophagus, heart, lungs, kidneys, and GIT, gastrointestinal system. Treatment is directed towards the forcing the disease into remission and slow its progress. So our target to stop the progress, because there are no curable, it is not curable. In this picture, we can see the calcium deposit in the finger. And here showing the puffy finger, this area. And here the digital ulcer and scar tissue developed. And this is a Raynaud phenomenon, whitish and then getting black. And here ulcer and scar formation. Next here, in this picture, affected scleroderma on the hand, right? So you can see getting involved. What are the sign and symptom or data collection? Patient complain the pain, stiffness and muscle weakness, pitting edema on the hands and finger that progress to the rest of the body. Also the shiny skin that is free from wrinkle, or skin tissue is tight, hard or thick, and it loses its elasticity and adherent to underlying structure. Patient develop dysphagia, decrease the range of motion, joint contracture, or inability to perform activities of daily living. In this picture, we can see some scleroderma or systemic sclerosis findings. Here you see the whitening, the tip of the finger, and here the tightness, and the normal skin lost the elasticity. And also the finger deformity and calcium deposit. And intervention encourages the activity as tolerated, maintain a constant room temperature, provide a small, frequent meal, which eliminating the food that stimulate the gastric secretion such as spicy food, caffeine, and alcohol. Monitor for esophageal involvement. If present, advise the client to set up for 1 to 2 hours after the meal. Provide supportive therapy as the major organ become affected. Admin corticosteroid as prescribed. Provide emotional support, encouraging the use of resources as necessary.